Thanks very much, Matt. You probably noticed that we were wearing our masks when we started today. This is not like throwback baseball uniforms, but it does remind me a lot of about 14, 15 months ago when we started wearing masks at press conferences and when we were together. Lots of news today, lots of interesting things going on in the state. We want to give you a vaccine update, which is the critical treatment for the the critical thing that we have in our armamentarium to fight COVID. And then we're going to talk more about the Delta variant in detail. We're also going to touch on the new CDC mask guidelines and what those mean for New Mexico. If I could have the next slide. People have been asking me, well, so what's it like working at DOH and what's your favorite part? And actually my favorite part of working at DOH is the people that I get to work with. We have some amazing people at DOH, and I don't want to say exactly, but there are some people that are so talented, and Dr. Chanchin Parajon, whom I'm going to call Laura for the rest of this, is one of them. She's really led the effort to make New Mexico the most successful in America in terms of that distribution of vaccine that we've received. And as you know, we took off a very, very early lead and maintained it through most of the pandemic with a dramatic finish in mid-June when we got to 60%. And so Laura is going to walk us through more about what we're learning about vaccines, more about what we're learning about equity in vaccination. But I did really want to recognize her for her leadership as she starts today, not to embarrass her, but to let you know, I couldn't think of a better person to be giving you this update. So Laura.
Thanks so much, David. And like I always say, it's really, we're part of a really big team here. And we just want to thank all the providers and all the hospitals and federally qualified health centers and National Guard, FEMA, everybody who is a big part of all of this. So thank you so much, David. And really, it's been a big team effort. So thank you for being our leader. I wanted to share a little bit of update on the vaccine. So New Mexico does remain among the vaccine leaders in the state, in the whole United States. We have 72.6% of New Mexicans having received at least their first shot, and 64% of New Mexicans are now fully vaccinated. So that's really exciting news. Next slide. And also thanks to all the New Mexicans who came out and got vaccinated. We're also seeing vaccinations among young people though. We're steadily increasing the 12 to 17-year-old age group. There's now 47.4% of New Mexicans who have received at least a first shot, and then 37.7% of New Mexicans who are fully vaccinated. We are a little bit worried about the 18 to 24-year-old age group as they're going back, back to school. That's our percentage that's the lowest for the fully vaccinated, and that's 40.7%. So this is something that we'll be doing in the coming weeks, is to keep on trying to get people vaccinated. Next slide. Another exciting development is that Pfizer and Moderna are going to expand their clinical trials for children 5 to 11 years old. That's so exciting because we really want to protect our kids. And so right now we're masking up to protect our kids, but soon hopefully we'll also have a vaccine for them. Next slide. So, New Mexico is doing really great in terms of getting vaccines out. We were amongst the fastest in terms of getting the vaccine out quickly. But are we reaching those who have been most affected by the virus? Next slide. So if you look at the data for the COVID cases, they are currently the highest for Hispanic and Latino populations, as well as African American populations, as you can see from the slide here. The pink here is Hispanic Latino, the blue is African American. Next slide. So while New Mexico leads in vaccine rates for Hispanic, Latino, and African American populations, ranking number 6 in the country for African American and number 5 for Hispanic and Latino, that's great, but also we need to actually look at our own data that we've been tracking this whole time. So if you can go to the next slide. Here you see that in our overall, for our vaccinations of people over 16 and over, The two populations that are not doing as well in terms of percentages are Hispanic, Latino, and African American populations. So both of them are below 50%. And then if you look at other populations, actually Native American populations are doing really great. So that's a great testament to people coming out, getting vaccinated in the IHS. We want to do the same for all populations. Next slide. We're also seeing the same type of pattern for 12 to 17-year-olds. So especially if you look at the 12 to 15-year-olds, it's worrisome for us because we want everybody to have the opportunity to get vaccinated. So we just want to point out that equity is really important to us, and we're doing everything we can to try to get out to all populations. Next slide. One of the things that also for COVID, you know, after really one thing that you can see in terms of the impact of COVID is after life expectancy going up uninterrupted for over 50 years, you can see the impact that as a result of COVID, we had a decrease in life expectancy in the United States. And this life expectancy was less for Hispanic and Latino population, as well as African American population. So life expectancy has gone down for those populations. So this is another point that we need to point out that, yes, we really need to work on how we reach Hispanic, Latino, and African American populations right now. We do not want to have more deaths, and vaccines are our best way to prevent these deaths. Next slide. So what are we doing at the New Mexico Department of Health to try to reach out to groups? Next slide. One of the things we've done is really make vaccine easy to get. So visiting the vaccinenewmexico.org or call at this number, 1-855-600-3453. I know you guys are probably really familiar with this now, but appointments are available statewide. So when you get on the website, you can schedule an appointment. Remember that vaccine is free for all New Mexicans. No insurance is needed. Immigration status is not needed. This is for everybody. Parental consent forms are also easily available. You can download them on the website, or we also have them at the vaccine sites. You can walk into vaccine site. And if you're a church or you're an organization, you're someone who wants a mobile event, please give us a call or click on this request for an on-site vaccination event. We really want to make this as accessible for all people as possible. And also remember to get the got shots right now. We're getting ready for school. You know, we also have that got shots where you can go on site and see that there's a ton of pharmacies and places available to get shots for your kids and adults too. Next slide. Another thing we're really trying to encourage, we know that so many of you providers have stepped up and really gotten signed up to be a COVID provider. We also know we have other providers who are just on the fence or might want to consider becoming a COVID provider. Just so you know, amongst unvaccinated people, you guys, healthcare providers out there, are your #1 preferred choice for getting the vaccine. So we know sometimes it's hard to get started, but we're also here and available to help you out. All New Mexicans are encouraged to visit their primary care providers right now and catch up on any missed care during the pandemic and talk to your provider about the vaccine. They can answer your questions. Primary care providers are also really, if we can make COVID-19 vaccine accessible, that's great. So visit takecarenewmexico.org for more information on how to become a provider or how to get more vaccines. So thanks so much. That's the update.
Thank you very much, Laura. Great update. And I think I'm particularly worried about that because that drop in life expectancy was greatest among African Americans and Hispanic Latinos. And, you know, in this state, that's something we need to be very concerned about. So we're going to move on and now talk about the case update, as we always do. And let's go to the next slide, and you'll see the familiar epi curve. The blue line on the top is the one I'm going to focus on, and that's the cases per day in New Mexico. We do a 7-day average. There's a little bit of a lag in there as well, and you can see that both of those there. And then the lines below the blue line are the different regions of the state. And so we're very concerned, and maybe someone just hit the space bar a couple times, and there, I don't know about you, but the contents of those two boxes look pretty similar. Similar upslope. I think we're going to see more of an upslope soon in the curve on the right. And I don't think it can go as high because this time we'll have 64 to 72% of people with both or one shot or fully vaccinated or partially vaccinated. So that's going to limit how high that curve should go. But there is some bad news about the Delta variant that I think is driving this change, as everyone on the MAT and modeling team and others concerned about the changes we're seeing in the data. You remember that we almost got to 100. We were vaccinating 100 people a day for every case. We're now down to 12 people a day for every case. Still a positive trend, still something we want to promote, but well below where we were before. And Laura went over the data on that quite well. Next slide. Here, I brought back the Washington Post. Someone asked me about it this week. This is a running set of curves that they publish. They're not my favorite curves, but they are quite instructive and informative. And so if you look at the top line, and the arrow is a little misleading. So that little dotted top line there is actually the overall case rate per 100,000 in America, so all comers. The next line down is the case rate for vaccinated people in New Mexico, or for unvaccinated people. So the good news is even our unvaccinated rate used to be much better than everybody in America. And now if you look at the second half of the graph after May, our numbers are tracking very closely. The gray line is everyone in New Mexico. What I wish was they didn't have the gray line and they had instead the fully vaccinated people, because that would be a line well below. But we are really, this data shows we're really in the middle of a pandemic amongst the unvaccinated primarily, but you will see a slight upward, that upward trend in all cases mainly reflects unvaccinated individuals. And we're still seeing those numbers where 95% of the cases, 94% of hospitalizations, 98% of deaths from the beginning are occurring in unvaccinated individuals. And so it's awful to have a death in New Mexico now that could have been avoided. Next slide, please. Here's hospitalizations, dotted line, the United States. The blue line below it is unvaccinated people in New Mexico. And you can see we've done well in New Mexico, better in terms of holding down the virus, even in unvaccinated people. And again, those lines are a lot closer together than they were in March and April and May. Again, we don't have the line below the gray line for unvaccinated people, but it would be just about as far below as the blue line is above and illustrate the gap. And so what we're seeing though is both case rates and hospitalizations are pretty similar now to where they were in March, on March 2nd. Nationally, cases have gone up by a factor of 4 in the past, since July 1st, so the past 4 weeks, a 4-fold increase in cases. And most of you who follow the numbers every day know that we were running 50 or 60 cases a day for quite a good number of weeks. And now we're up in the 240 to 260, so a very similar ratio. Next slide. This is a little bit complicated slide, but you don't have to be a master of slide reading to interpret it. The Delta variant is the bright or the darker orange bars on the graph on the right. And you can see it goes from a sliver on April 24th to what's now 83.2% of all sequenced variants in the United States. And we're very worried about this virus. I'll go into more detail, but a very early study when Delta started emerging in mainland China and India found that people with Delta had 1,000 times more viral particles in their nose than previous strains seem to induce. So a lot more virus, which we believe means a lot more spread to other people. We're seeing significant problems nationwide. And so you've read in the news, California and the city of New York are actually requiring their state workers to show proof of vaccination, which we do here, and also to undergo regular testing, which we don't do here. That undergoing regular testing is for unvaccinated. So if you work for the city of New York or the state of California, you have a choice. You can get vaccinated or you can get swabbed. I think it's once a week. Last thing is, we sort of predicted in June that Delta would probably hit the 70% mark in late July or early August. We got off to a slow start. We have about a 2 to 4 week lag. And our most recent official report a couple of weeks ago showed 22%. One last week that we did was 55% roughly. But because of the speed of the increase in the virus and the lag in getting the specimens, I think the modeling team and our folks in EPI are saying we have to have, it seems like at this time, about 75 to 80% of all cases in New Mexico are now the Delta variant. And this should, I think if you've held out for a while thinking you're not going to get COVID and decided not to get vaccinated because of that, I think this should give everybody who sees this pause. And I'll show you why on the next slide. So you've all heard me say there are 4 things you need to know about every variant that comes down the pike. And we've given you more than just 4, but that's okay. I'm going to deal with the main 4. When we had the Alpha variant spread in England, where they have the best epidemiologic systems in the world, that we knew in December what the spread rate was, what the hospitalization and death rate was, what resistance to treatment existed with the Alpha variant in England, and whether they were resistant to the vaccine. And because the Delta variant has spread so rapidly in other places, we don't have solid data. So even some of the numbers in here, if I have them, are based on just one study, which isn't enough. The question marks are places where we're not really confident in any of the data. So what we're finding, though, is that the Delta variant spreads 3 to 5 times more than the variants we've been used to this whole time. Alpha was a little higher, but Delta 3 to 5 times. There's a good paper that shows that if you live in a household with someone with coronavirus, you have more than a 50% chance amongst the people there of getting it. That used to be 16%. We're also seeing a lot of clustering of cases in New Mexico, which is something you would expect. So like whole families, almost everyone who was at a party together in a household, getting infected, getting the virus. And that, I'm laying the groundwork here to why the CDC changed their masking guidance yesterday. So number 1, does it spread faster? Absolutely, and frighteningly so for Delta. Number 2, is it likely to cause more hospitalizations and deaths? And in Scotland, where this was done, they did see an 85% increase. It's the only place we have data. So far in New Mexico, it appears that the increase we're seeing in hospitalizations really parallels the case count. We're not seeing excess hospitalizations here. So we're gonna have to wait and see how that data pans out. Are these variants resistant to treatment? With Alpha, we knew well in advance, and we actually changed the whole treatment regimen in New Mexico like the day we got the first case. And so we had that covered, and it looks like Delta, while resistant to some like BAM and other single agents, does respond to the cocktail, if you will, the combination of monoclonal antibodies that we're giving people. And I just want to stop and remind people, if you get COVID and you are over 65 or you have any risk factors at all for complications of COVID and, obesity, high blood pressure, heart disease, lung disease, and there are others, asthma, you can look online at the list, and you get COVID, get treatment. You lower your chances of going in the hospital by 75%. And then I think we feel, based on our data so far, that there is not, while we see some people getting the Delta variant who've been vaccinated, we're not really seeing much in the way of excess hospitalizations and not seeing much in the way of deaths at all. And so that's good news. And we said that at the very beginning. The good thing about the vaccine is it dramatically lowers hospitalizations and deaths. It doesn't prevent every infection. And that's what's panning out with Delta now as well here in New Mexico. Okay, next slide. So how do you avoid the Delta variant? You can put yourself in lockdown, I suppose, and stay at home, not see anybody at all. But that's not practical for most people. The number one way to manage this is to get vaccinated if you're not already. The more New Mexicans we have as a breeding ground for the virus, the more world citizens we have who aren't vaccinated, the more variants we can produce. And, you know, we have hundreds and hundreds of variants of coronavirus, but the Alpha one had a significant increase suddenly. We saw it in New Mexico, came in, now it's going away. And the Delta variant, very significant increase. And we will watch to see if it declines. So get vaccinated for yourself, get vaccinated for your community, get vaccinated for your family, and particularly if you have regular contact with anyone with a risk factor, it's a great reason now to get vaccinated. And so, and the more vaccinated we are, the fewer variants will be able to take hold in our state. Next slide. Another concern we're watching very closely is test positivity. You may remember that we were positively focused on test positivity. It was in the gating criteria. Originally, we didn't want it above 5%. We relaxed that to 7.5%, but it is going up. And why is that a big deal? When we see the positivity rate rising, it's generally an indication that there may be more cases out there than we know about. And with the Delta variant, that's 3 to 5 times a bigger problem, not knowing those cases because of their ability to spread. So we're not doing 5,000 tests a day most days of the week now. We need to get that back up to manage the virus, to identify cases, to isolate them, to get a hold of their contacts and quarantine their contacts. We're still meeting our metrics for those isolation and quarantine. And then the other thing is I've run into some people I know who say yesterday I had a headache and kind of a runny nose and I felt kind of blah. I think I'm feeling a little bit better today. Or maybe they had a little cough or a sore throat was one of them. And I said, well, did you get tested for COVID? And they looked at me very surprised. And they said, well, I'm vaccinated, so I don't need to get tested for COVID. And I said, that's not true. The recommendation has always been anyone with symptoms needs to get vaccinated for COVID. So that's just a reminder, vaccinated individuals, unvaccinated individuals, which is pretty much all New Mexicans. If you have symptoms, get tested. That's the only way we can contain this virus. I think we've gotten a little bit relaxed. I saw a headline that said America needs a wake-up call. And so maybe that's what I'm doing here. But the pandemic is not over. I say at every press conference, it isn't over. And it now is getting worse, a 4-fold increase in cases every day. Fourfold increases. There's a 4-fold increase in cases today compared to July 1st. That's a serious problem. Next slide, please. So a reminder, if you have symptoms, now notice it doesn't say you have to be unvaccinated in that upper left-hand corner box. I've listed all the symptoms. Some people just have headache and some muscle pain or a runny nose and some nausea or vomiting, particularly in kids. And so get tested if you have symptoms. If you don't have symptoms and you're unvaccinated and you live or work in a high-risk congregate setting like nursing homes, detention centers, correctional facilities, you are already getting regular testing. That's what's going on here in New Mexico, regular testing. And now that's what states like California and cities like New York are implementing. I added something here on the upper right. If you don't have symptoms, but you're unvaccinated, and now even if you are vaccinated and we're in really close contact with someone who just recently tested positive and infectious, I know that's not an official guideline this is what I plan to do. If someone in our household turned out to be COVID positive this week, I would immediately go and get tested, even though I'm vaccinated. And then, of course, there's the routine testing that we're doing for some, but not all procedures now prior to hospitalization and surgical procedures. Next slide, please. Okay, there's new CDC masking guidance for the fully vaccinated. And remember, for the unvaccinated, it suggested that people wear masks in every indoor setting anyway, and a lot of outdoor settings as well, especially large crowds. Now the CDC is saying that fully vaccinated individuals should return, and they're recommending they should return to wearing a mask indoors when they're outside their homes, particularly in areas of substantial or high transmission. I'm really glad we're not one of the southeastern states that's just completely and totally all red, but we have our share of red if you look at the map of New Mexico, and those case numbers are going up. You or someone in your household has a weakened immune system. We've talked about this repeatedly, or is that increased risk for severe disease? Wear a mask around them. You can transmit it still without symptoms. We don't want you to carry it. And then also CDC is saying everyone, teachers, staff, students, or visitors in K through 12 schools need to be masked. Just a reminder that the latest public health order says regarding masking and social distancing, it says that New Mexicans should do what the CDC says we should do. And so when the CDC makes a change like they have just now in masking guidance, that automatically becomes part of our public health order. So I wanted to let you know that. I also, there was one other thing about that. Oh, the schools, public health officials are working with school officials here in the state about schools. And we have word that there should be additional school guidance coming out from the CDC for other things than just masks. And so you will see those updates being made as we get that information as well. But I know we warned you not to throw away your masks. Hopefully you didn't wash them up. If I bet they're all washed and folded in your drawer, get them out, put one in your car. I'm not leaving, I wear them now when I'm outside my home. Lastly, at the modeling team yesterday, we asked people, this is before the CDC guidance came out, like in the past 2 weeks, have you changed your own personal approach to masking? And virtually everybody who spoke had. They were wearing a mask more. They were wearing it outside. They were being much more careful in indoor spaces or eateries where they had to have their mask off. And so, public health officials were a couple of weeks ahead on this, making these changes. But I think they're the right thing to do, given what we're seeing. Not only that 4-fold increase in cases, but the 3 to 5-fold chance of getting infected if you're around someone with the Delta variant. And people say, well, how do I know if they have the Delta variant? It's like, well, probably 80%, 75, 80% of folks do. So you might as well just assume that and act accordingly, that you have a much higher risk to pick the virus back up. The vaccine will protect you fairly well from hospitalization and death, but you don't want to get it and spread it to someone else, particularly a close family member. Next slide, please. Vivek Murthy, who's just an amazing individual. He was here in New Mexico a couple weeks ago. He talked a lot about fighting against misinformation. And I've been the recipient of more misinformation about masking in kids, about anything, actually, more misinformation about anything in the past month than I have in the previous 6 months. And so there's a lot of myths out there circulating, a lot of beliefs. And I think it's important to call this out, that we really have to be careful with what we read and what we see. And the internet is not always the best source of information. It can be a source of misinformation and help us make bad decisions. On the next slide, because of all the calls I get. People sent me papers and things like that. There's some myths out there about mask wearing. One is that wearing a mask reduces oxygen intake and can make it hard for children to breathe. Oxygen is, the holes in an electron micrograph of the mask are massive. Oxygen molecules are tiny. Oxygen freely flows. That's hard to say. Freely flows through the mask and is not an issue, and no drop in oxygen levels have been seen. In kids, masks can interfere with children's lung development due to the oxygen starvation. It's just not true. Here's my favorite. Everyone sends me this article. Masks trap carbon dioxide that children normally breathe out. That article was placed on the internet 4 weeks ago. It has been retracted by the authors of the article. They say their data was flawed. And in fact, we have a lot more carbon dioxide in the air we breathe out than the air we breathe in, right? I mean, that's how it works. You breathe in oxygen, it gets converted to carbon dioxide, you breathe it out. And so that article is very flawed, and don't bother sending me another copy. It is clearly, I think, the worst example of misinformation I've seen during the pandemic. Next one, myth. Wearing a mask can weaken the immune system by putting the body under stress. That is not true. It does not weaken your immune system. It does not increase your chances of getting sick if you're exposed to the virus. It decreases. And then the last one I've been hearing lately is teachers and school staff do not support childhood masking. My child's teacher does not support this, but pretty much nationwide yesterday, if you saw the news, teachers all over America came out and said, the CDC is doing the right thing. We want our kids to be safe. We want to be safe. This is the right thing to mask everybody in K through 12. And so I just want to go through some of the data. We have more information on the website about all the articles on masking, and also masking in children if you're interested in more detail. And then, and here's just a quote, the teachers union reacting to the Delta variant, and they said what I just told you they said, so I won't read it. We want to keep the schools open. To do that, we have to do everything we can to mitigate spread. Next slide. So the virus is changing like big time. Please get vaccinated this week. The variants spread more rapidly. If you have any symptoms, if you think you have COVID-19, if you've been exposed to someone closely who's positive, that me being vaccinated now does not make me feel like I shouldn't get tested. So I will get tested if I get exposed. If you have COVID-19, I said it earlier, get treatment. Please get treatment, particularly if you have a risk factor, and be super careful indoors, no matter where you live. In New Mexico, the map can be misleading with a red county and a light colored county because people travel from county to county. We have 2 giant interstates crisscrossing the state. And so be super careful, and then do all those things that we know to do. And we've changed unvaccinated people mask up to everyone mask up. And with that, I think, and again, encouraging, as Laura did, for you all to get preventive healthcare. I think with that, I think that's my last slide. And is that right? Slide operator? Yes. So we'll turn it back. We'll get Laura, turn your camera back on, and we're happy to take all your questions today.
Great, thank you so much to our principals. We will begin with Steve Edmondson, followed by Algernon Damasa, and then Matthew Reichbach. And if you would just identify the outlet you're associated with when you are unmuted. Steve, we'll begin with you. You are unmuted.
Okay, can you hear me now?
Yes, sir.
Okay. Steve Edmondson, I'm from Mine Country 1021 in Socorro, New Mexico. And Dr. Scrase, a couple of questions here. You showed the chart earlier that showed the rise in cases. If you look back to last year, about this same time, there was also somewhat of a surge. So do you think that some of what we're seeing right now is just a seasonal aspect of this, because we did, like I said, last year we saw the same type thing. And the other question I have has to do with the masking. And again, we had mask mandates from May 15th last year was when the mask mandate was put in. In the 3 months following that, every month the case counts went up, and the third month from June, July 15th to August 15th, in that period, we had an 86% increase over what we had in the month before we had any mask. And so I'm just trying to figure out how that demonstrates that the mandates are really effective. And you can look at charts from states and countries around the world and see similar things. And so I'm just asking, have you looked at the data from others or charts from other places and seen when they put their mask mandates in, and then seen the rise in cases even while they have those and some very strict mask mandates? Thank you.
Yeah, I'll start. Laura, feel free to add. On the seasonality, I think there's some of us that believe that eventually coronavirus will settle into a pattern that is similar to other respiratory viruses, where we get more of it in the winter, but the virus keeps mutating, and we haven't really had the chance to have it die down enough to emerge in the winter and then go away in the spring, similar to influenza. So I don't think what we're seeing in the summer is a mask mandate. As far as, hey, as soon as everyone started wearing masks, all of a sudden cases went up. That kind of ignores the reason why the mask mandate was put in place was because there was rapid, unrestrained community spread. So there are 9 rules to tell the difference between correlation, which is when one thing A happens and thing B happens afterwards, and causation, where thing A happens and it creates B. But I think there's a large body of science about the effectiveness of masks that flies directly in the face of the theory that masking caused the cases.
No, that's not what I said. That's not what I was saying. Can you still hear me?
Yeah.
Okay, that's not what I was saying. I'm not saying that they caused the cases to go up, but unless you're going to argue that there were less people wearing masks before the mandate went into effect than after, shouldn't the caseloads have stayed lower than instead of rising over the next 3 months? Now, they did go back down, and after August they went back down, but we kept the mandate in, and then they went back up, and we had the mandate in all through the biggest period. We had 75,000 active cases from about December 12th to January 16th, and the mask mandate was in effect in that time. Is there anything to indicate that people weren't wearing the mask during those time periods? Because I just don't see how, if the mandates are very effective, you would have that kind of rises.
All right, thanks. I'll give a quick answer and we'll move on to the next question. But I think what you're comparing is before and after, and that's not a valid comparison. What you want to compare is what we got versus what it would have been had no one worn a mask. This has been studied all over the world with and I presented this, I think last summer or fall. I think it was 20 or 30 countries where they looked at the correlation, and countries who did do earlier interventions limited the rise in cases. And so I think it's better to just talk about public health interventions in general. I can tell you that I've been out, every month since the beginning of the pandemic, and every time I've been out, I've seen people who weren't wearing masks. So I don't know exactly what kind of evidence you're looking for that some people don't wear masks. I would encourage you to go to your local mall and you just count 100 people and see how many are wearing masks, and that would be a good representation of the percent. So I think the evidence for the effectiveness of wearing masks is sound, it's solid. We've got 25 references, and the evidence that implementation, particularly rapid implementation of public health measures to control the spread of the virus, are also effective. And the earlier you do them, the more effective they are. So thanks.
All right, thank you. With that, we will turn to Algernon Damassa. Algernon, you are unmuted, and following Algernon, we'll have Matthew Reichbach and then Jeffrey Plant. Algernon, you should be unmuted. Please feel free to ask your question.
Thank you. Algernon Damassa from the Las Cruces Sun News. Thank you, doctors, for the update today. I just want to make sure we understand what the recommendation is, because the CDC has these new color-coded maps showing areas at the county level of high or substantial transmissibility. And I just want to clarify whether it sounds as though this New Mexico's guidance is that this is a statewide recommendation that people mask up indoors, although we do have counties with varying levels of transmissibility. And if it is a statewide recommendation, do you want to say anything to residents of blue counties or the yellow counties who might feel like, I live in an area of low transmission and therefore the risk for me is, I'm not going to come.
Yeah, I think that's a great question, Algernon. And I think I might have talked about what I was going to do and people on the modeling team were going to do as though that were a recommendation. Our recommendation really is the CDC guidelines. So that would be by county right now. It does recommend people who live, in those counties. But I think out of an abundance of caution, everyone in New Mexico should follow those guidelines. I mean, these curves are going up pretty steeply, and whatever it is this week is going to be different next week and probably higher. And so, New Mexico is small enough and Delta transmission is high enough that I think you're not going to see the sharp distinctions from those counties soon. But so I think I certainly personally recommend that everyone wear a mask. The way our public health order is written, it ties our guidance directly to the CDC. Hopefully that covers it. But thanks for raising that, because I think I may have overemphasized the discussion in the modeling team and myself. My preferences is the state recommendation, but we're looking at all of it again. Next.
Thank you so much. Next, we'll turn to Matthew Reichbach of New Mexico Political Report, followed by Jeffrey Plant, and then Julia Goldberg. Matthew, you are unmuted. Please feel free to ask your question.
Yeah, Algernon kind of took my question, but luckily I have a backup. Just wondering, with the increase in hospitalizations, are hospitals worried about being overrun again as they were for parts of last year, about filling up with COVID patients, and especially now that folks are going to care that they delayed during the height of the pandemic? Just wanted to check in on how hospitals are holding up.
So that's another really important question. And I think that we're in a place right now where it is a problem. The hospitals are full, particularly the big hospitals in Albuquerque. They're over full. Most hospitals in the state are full of patients, as you sort of astutely pointed out, who have delayed their care, and now their medical condition has forced them to go to the emergency room rather than getting it treated by a primary care doctor. I'm particularly worried about the increase in the spread with Delta variant, that could accelerate hospitalizations. But right now in New Mexico, the hospitalization rate, the percent of people who get COVID who end up in the hospital is stable. And so that Scottish 85% increase is not showing up here. But I can also definitively tell you that we will not have adequate space for everyone if we see, if we get up to 1,000 cases a day. And so that's why we're urging people to have caution, and we will go through the same drill we did before to convert outpatient spaces to ICU beds or hospital beds or whatever it takes to increase our capacity. But I would say, in general, New Mexico hospitals are pretty close to full now. They can stretch a lot, like they so amazingly did last November and December. But right now, they're super busy caring for everyone. And remember, it's not just delayed care. I mean, people have babies, people need surgery, people need routine things that aren't delayed, and they're getting those as well. And so we monitor that really closely. The hospital group checks in every week to talk about the data and the numbers. And I think they're really on top of it, and they're prepared to make the changes they need to make because they've been through this now a couple times. Thanks.
Okay, thank you so much. Our next question will come from Jeffrey Plant, followed by Julia Goldberg, and then Cedar Atanasio. Jeffrey, you are unmuted. Feel free to ask your question.
Can you talk a little bit about the populations that are at risk right now and how that might play into your thinking as far as maybe going back to a red to green sort of orientation for public health measures, aside from kids under 12 and vaccinated folks, older vaccinated folks and those with chronic health conditions. The rest of the people that are at risk, maybe even a majority of them are do you think they're choosing to be at risk and maybe they don't want to be protected is what I'm thinking. So does that play into the state's thinking at this point?
I'm going to let Laura start because she's kind of our expert on high risk populations, and I'm going to tell you a story.
Okay. Yeah, thanks so much for asking that question. It's a really good question. So basically, the people who are most at risk right now are the unvaccinated. And then I think amongst the group of unvaccinated, there's certain groups that are more at risk in that group in terms of, every elderly group, the group of people who are elderly, they have been vaccinated at a very, very high degree. So what we're mostly worried about are, like I shared before, was lower populations that aren't getting vaccinated. So that is Hispanic, Latino populations, African-American populations, but also certain regions of the state that you can see on the maps. You can see certain areas that aren't vaccinated. I know that at the end of the day that getting vaccinated is a personal choice, but the data is out there, right? The reason why Delta variant is spreading is because COVID looks for where they can go, right? Right now it's going to the unvaccinated, and then Delta variant is allowed to then cause more variants, right? By having a pool of people who are unvaccinated. So even if you think you're healthy and you're doing okay, getting vaccinated is the way we can prevent the spread of these variants. And if you look at the data, 97% of the people who are hospitalized right now and 99% of the deaths are all from people who are unvaccinated with COVID. So like I said, it's a personal choice. We understand that, but we really encourage people to talk to their providers, talk to people they trust, and then get their answers and their questions answered to really, so I don't know, I don't know if you're saying like, maybe people don't want to get vaccinated, but what we're trying to say is, yeah, even if you're healthy, do it for your kids, do it for the community, do it for yourself, because even if you are healthy and you get COVID, there's also long COVID that even if you get over your acute symptoms, you can still have long-term symptoms. So I just wanted to share that piece of the puzzle.
Yeah, thanks, Laura. And I want to share the story because it's really moved me, and as a physician, particularly hit me hard. A very close friend of mine is also a physician. He also takes care of older people. He had a couple in their early 80s, very vigorous, thriving couple, exercise, the whole thing. He would only see him once a year. And because they were so healthy, and just kind of see him and maybe refill their a prescription or two for them. And what happened a couple months ago is the wife got sick first and rapidly got worse, went to the hospital, was diagnosed with COVID. And just as she was being moved to the intensive care unit, a couple days later, her husband was sick enough to go to the hospital. He ended up in an inpatient bed, and then he was moved to the intensive care unit just about the time his wife died from COVID. And he was being cared for in the intensive care unit, and he was kind of at that moment where they were talking with him about end of life care. And because it was apparent that he was not going to make it either. And my friend went to visit him. And, in healthcare right now, visiting is very different than normal, but he was all masked up and PPE'd up. And he was looking at the patient through the window of his closed door ICU room, talking to him on his cell phone and his patient who just lost his wife on her cell phone, and his cell phone, the patient's cell phone. And the patient just said, boy, I guess we really should have gotten the vaccine, shouldn't we? And then that patient went on to die later that day. And so, you know, I just don't want to see anybody else have to be in that situation. There's lots of things we all regret in life, but ending our life because of a choice not to take a proven therapy. I mean, I respect people's right to choose, and I'm not judging that, but I'm just pleading with New Mexicans to really think this through carefully, because the consequence in many cases, over 4,000 cases in our state, has been death.
Thank you both. Next, we'll turn to Julia Goldberg, followed by Cedar Atanasio. And at this point, I don't see any more hands raised, but if other members of the press would like to ask a question, by all means, raise your hand or pop it in the chat and we will ensure that it gets answered. So for now, Julia, you are unmuted. Please ask your question.
Thank you, Matt. This is Julia Goldberg with the Santa Fe Reporter. Thank you, Dr. Scrase and Dr. Parajon. I wanted to ask if you could talk a little bit more about breakthrough cases. At the start of May, the CDC said it was only going to investigate breakthrough cases that involved hospitalizations and deaths. In this news conference on June 2nd, I asked Dr. Christine Ross, and she said the state was following the CDC guidelines. In our press conference 2 weeks ago, Dr. Scrase, I believe you said that actually we're doing beyond that. I just was hoping you could maybe talk a little bit about, I know the variants of concern report says that the samples from breakthrough cases are being more frequently sequenced. I just didn't know if you could explain or even quantify a little bit more what's known about breakthrough cases here, as that's the number one thing I'm hearing concern about from people.
That's another great question, Julia. I spent about a half an hour on the phone night before last with Dan Sossin, one of our epidemiologists that wonderful man, has really fought hard during this pandemic for New Mexicans. He hasn't been on a press conference yet, but maybe I'll put him on warning with these comments. And the CDC has not outlined a clear-cut methodology for states to study vaccine breakthrough cases. And so the CDC is mainly focusing on people who've been vaccinated, who appear to have COVID, a positive COVID test, who are hospitalized or who die. And we've talked for over a year about the 2-week lag between cases going up and hospitalizations, another 2 to 4 weeks hospitalizations and deaths. So by sampling that group later, we're and looking for variants and things like that, there's a delay. I think the other thing that we're beginning to understand, I think, is, and I don't have the numbers right in front of me, so I'm gonna estimate, but about 85% of vaccine breakthrough cases have not had a previous COVID test. 15% of them have. And there's a growing body of, I'll just call it suspicion, that those people who had COVID in their nose like 2 months ago and have it there now, it may well be the same COVID and not a vaccine, somebody getting infected with full immunity. So we're looking at studying that data, and they're running some numbers now. What do those vaccine breakthrough cases look like without the people with a previous positive test? And then there's another way of cutting the data into 3 groups: people who had symptoms, which I think is about 55%, people who didn't have symptoms, which is about 25%, and people we don't know for one reason or another, we don't have that data on them, which is about 20%. And although there's, well, I won't say that. I think that we're going to get a lot more information out of studying the population who've been fully vaccinated, who have symptoms and don't have a prior positive COVID test. And so that's how we're cutting the data now. But overwhelmingly, as Laura said earlier about high risk, being unvaccinated is the main risk factor. We knew the vaccines weren't perfect when they first came out. The initial research data was based on 2 months after full vaccination. Pfizer 95%. And I was expecting to see a bigger drop, into the 80s, but so far we're not seeing that. So I guess the answer to the question is we're digging deeper right now to understand it more. And if you're worried, I think if you're worried, if you're vaccinated and worried about getting reinfected, we've just gone over a host of things you can do to avoid that, including putting the mask back on. Thanks.
And can I mention something else, David?
Yes.
Just thinking about breakthrough cases, I think that we are going to expect that there will be breakthrough cases, but always remember the reason for the vaccine is to, for the most part, prevent illness, prevent hospitalizations and deaths. And the vaccine is doing really, really well to do that. And so, yes, we will have some breakthrough cases, but most of them are very mild. And so I think just remembering that, despite the breakthrough cases, because it seems scary, right? Especially with the Delta. And, that's why I think we have that's why CDC has recommended the mask wearing in indoor locations, even if you are vaccinated, because yes, we're dealing with a different, a different variant that's much more powerful in terms of being transmissible and infectious. So just wanted to add that in terms of, thinking about the vaccine.
Thanks to you both. All right, our next question will go to Cedar Atanasio, and I don't yet see any remaining hands, but we'll wait and take another look-see after Cedar's had a chance to ask his question. So Cedar, you are unmuted. Please go ahead and ask your question.
Hi, Dr. Parajon, Dr. Scrase. Thank you as usual for hosting this. I wanted to ask about testing. Vaccine rates are super low amongst kids. We're about to go back to school, and there was a testing regime in the spring when a lot of kids were still at home. And we've talked about masking. Can you talk about the role of testing this fall and how you envision it kind of complementing the other things that we're doing?
Yeah, I can start. I don't have the public education department document right in front of me, but there is a testing plan for teachers and for kids to complement, just as you said. I really appreciate you asking about testing, because I think the thing that's going to help us manage the emergence of Delta is actually the rapid isolation and quarantine. And, if it's 5 times more likely to spread, the faster we get those people alone in a room without other people interacting with them, the more we can limit spread. So there is a testing plan with a defined frequency for both teachers and students. And I believe the plan is online. And I don't want to quote numbers from it because I know I saw a version of it. I know I remember the numbers, but I don't know if that was the final version. But there is a pretty regular schedule where both kids and teachers do get tested, particularly unvaccinated kids and teachers. Then, of course, would plead and recommend any parent, any student, if you wake up in the morning with symptoms, no matter how inconvenient it is, please do not go to school. Please don't go to school. Stay home. And so I'll have our folks, Cesar, we'll get you that link to the PED guidance and tell you, but it is regular testing for unvaccinated folks, and I believe even some for vaccinated children as well. So,
and Dr. Scrase, if I could just follow up briefly on that, I had to read this more recently than I think you did. So it's 25% required for staff and 25% voluntary for students. I guess I was a little curious if the voluntary testing for students thing worked out in the spring, if anybody really did it.
Yeah, we had quite a few in-school tests. Don't have those numbers in front of me either, but I think it's a good adjunct to being unvaccinated and getting the testing. And so I do think that it worked out, and we have numbers somewhere of those tests done in school. PED tracks that closely, and they work with our epidemiologists to generate school-specific graphs. So we have tested there as well.
Appreciate it.
Okay, well, that brings us to the end of the reporter list of folks who wanted to ask questions. So with that, Dr. Parajon, Dr. Scrase, any closing words?
Go ahead, Laura.
No, I just want to thank you guys for being here, and thank you so much for working together to try to get more people vaccinated. We have a tool that we didn't have last year, and so let's try to use it. So thank you. And
I would just say too, I should do this every time. I only do it every other time, but thanks to the media. I mean, this is all about communication. It's all about getting the word out. Not everybody has, brings up the CDC website every morning with their coffee or, even reads the newspaper. And so appreciate you getting the word out. Appreciate the stories you do. Appreciate the tracking of the cases. Appreciate the focus on the Delta virus and its infectivity. And there are still thousands of lives left to be saved here in New Mexico. And we need all New Mexicans, and particularly our folks, our media partners, to get this word out so we can continue to save many thousands of lives. And with that, Matt, I think we're done.
Absolutely. We'll let you, the press corps, know as soon as we've got another press conference scheduled. Thanks so much for your participation, and good afternoon.